Well, welcome and good morning. What we're going to have you do today is not use your audio. If you have any questions for us, we would like you to engage us through your chat function, and we'll accept the questions at the end. Dr. Bolton is with us, and she is going to be moderating the chat. So if there's something that you need to say in between, feel free to type it in and she can jump in. Before we get started, I'd like to make a couple of introductions. We have some of our faculty members who decided to join us today. So I'm Dr. Michelle Wiley. I'm an assistant professor here at Shenandoah. I teach at the Scholar Plaza site. I teach primarily in the professional issues series. I also teach in neuro and in pediatrics lab. So I'm going to have some couple other people just jump on when you want to, faculty.
Okay, I'm going to jump on only because I'm dual Zooming right now. I'm also in a class. So I'm just going to say hi really quick. My name is Dr. Megan Bureau. I'm the director of ClinEd for the PT program. I'm also an alum. I graduated from SUPT in 2004 in the first DPT class. I've been practicing in predominantly orthopedics and sports since then. So I have a sport certified specialty. I work with some orthopedic surgeons in Northern Virginia. I'm also a delegate for the APTA for Virginia, so kind of our governing board for our national organization. So obviously my kind of main role is ClinEd and helping place all of our students in their clinical experiences. I also teach in the professional issues series, and occasionally you'll see me in the musculoskeletal series as well, usually in a lab. My primary location is at Scholar Plaza in Leesburg. But because of my role as the DCE, I split my time between the two sites.
Thanks, Dr. Bureau. Have a great class today.
Thank you.
Hi, I'm Dr. Jill Boysenalt, and I also am primarily located at the Leesburg campus in the Scholar Plaza building, and I teach professional issues with Dr. Wiley and with Dr. Bureau. I also teach along with Dr. Devine the women's health content in the third year of the curriculum. I assist in one of the therapeutic exercise classes, and I'm one of the primary research advisors in the research track and kind of keep track of your research projects in your third year. I'm also the associate director at the Scholar Plaza site and enjoy interacting with all of the students there. And I get to travel over to the health professions building a couple times, well, usually like 4 or 5 times every semester. So although we say we're located at one building or another, we're always interacting with both groups of students. So welcome, and I hope you enjoy your virtual open house.
I can go next. I'm Dr. Wolf Burke. I'm the Associate Director of Clinical Education. So I work with Dr. Bureau and Dr. Devine, who maybe you'll meet this morning, on the clinical program, you know, making sure that there are places to go and for your clinicals and that things go well and your clinical instructors know you and know how to teach you. I also teach the amputee rehab content. I participate in and direct one of the part-time clinical experiences where we call it PT and ski, and you see patients for half a day and then you teach them skiing. We're probably going to broaden that a little bit to more adaptive sports, given that it's getting harder and harder to ski in Virginia. I help out in some of the professional issues classes. I've been at Shenandoah for 21 years. We're a great group of faculty, love our students, and thanks for joining us on this virtual open house.
Thanks, Missy. I'll go next. My name is Dr. Thomas Turner. I've been on faculty 14 years now. My primary location is at Winchester. I teach in primarily the basic science curriculum. That's gross anatomy, histology, physiology, pathology, pharmacology, kind of the ology guy, as they might call me. My primary clinical work right now is in wound care. I've dabbled in a little bit of orthopedics and acute care and acute inpatient rehabilitation, but right now I've kind of settled in on wound care and really enjoying that and having a good time working with a certified wound specialist and really increasing my skills. I also serve as the admissions committee co-chair along with Dr. Aaron Hartstein. You may meet him as well today. And I've been doing that for about 7 or 8 years. So if you do apply, you will certainly run across your information, and you'll very likely run across my name and his name as you go through that process. So as everyone else said, I want to welcome you to this virtual open house. Appreciate you taking the time to do that and be here with us and learn what makes our program really special and what I think will be the best decision for you to make when you decide about physical therapy programs.
I can go next. I'm Dr. Sherry Hale. I'm the program director here for Shenandoah University Division Physical Therapy. So like everybody else, welcome to the Zoom and to our virtual open house. We're excited to have you. And also just thinking of all of you as all of you deal with everything related to this COVID-19. I know many of you are undergraduate students who are trying to navigate uncharted territory at your institution. So we wish you the best of luck. We're thinking of you. As far as my teaching load, I teach mostly in professional issues and in research. Sorry, I have a visitor. This is part of working from home. So mostly in professional issues and research is kind of my primary teaching content. Because I'm the program director, I do cover both sites, but I'm primarily located at the Winchester location. So welcome and thank you for joining us.
Dr. Hartstein or Dr. Bolton?
Yeah, I can go. Good morning. My name is Dr. Aaron Hartstein. I've been on faculty at Shenandoah for this is my 6th year, and I've been a PT for almost 17 years. I primarily teach out of the Winchester location at the Health Professions Building. My primary area is I'm involved with the orthopedic and the therapeutic exercise curriculum, along with Drs. Bolton and Dr. Lee Avery. My clinical practice, I still work 1 day a week, as we all do, at a local outpatient private practice here in Winchester. Another duty that I'm involved with is I'm a residency faculty member and mentor for a residency program here in Virginia. And so half my time that I'm in clinic, I mentor a resident annually, and I've been doing that for quite some time now, maybe about a dozen years or so. Along with Dr. Turner, I'm also the co-chair of the admissions committee. So if you do end up matriculating towards the program, then we'll likely be interacting with you much more. And just want to echo everybody else's thank yous and appreciate your flexibility and your willingness to hop on a virtual open house like this on Saturday morning. I think it shows a lot about your desire, and also hopefully you see our desire to continue teaching under these circumstances. So thanks, and hope you have a great open house.
So I'll round it up for the faculty greetings. I'm Dr. Cameron Bolton. This is my 4th year with Shenandoah on the faculty side, but I'm also a graduate of the DPT program. And so clinically, I practice in orthopedics, and then for teaching, I teach primarily in anatomy. I'm a member of the Virginia Anatomical Advisory Board, which is a board that kind of mandates policies and procedures for cadaveric dissection. I also teach in the musculoskeletal and therapeutic exercise curriculums with Drs. Hartstein and Lee Avery. I'm also a graduate of the residency program that Dr. Hartstein just mentioned. And so we have a great group of faculty. We're really excited about this open house today, and part of my role today is to answer questions at the end of this session. So hopefully you have those written down or bottled up, and then you can release those into the chat at the end of the session today.
Thanks so much, Dr. Bolton. And as I said, Dr. Bolton is going to be moderating our chat room. In addition to our faculty today, who've been nice enough to jump on with us, we have 4 of our students with us. Juliana is a second-year student who is at the Winchester campus, the Health Professions Building. We also have Corinne, who is a first-year student from the Health Professions Building, joining us. Hey, would you guys like to jump on the mic and introduce yourselves so everyone can see you? Because we have Corinne, Juliana, Kaylin, and Nicole with us. Go ahead, guys.
And Caitlin Goodhart.
I can start. My name is Kaylin Bozick, and I'm a first year at Scholar Plaza. And I love PT school. It's so much fun. Really enjoy labs is probably my favorite thing this year. So I'm looking forward to answering your questions. Welcome, everyone.
Hi guys, my name is Corinne. I am a dual student at the HPV campus. So not only am I a physical therapy student, I'm also an athletic training student. So if you have any questions about that program, I'd be happy to answer them. I'm really happy to be here today and hope I can answer all your questions.
Hi, I'm Juliana, and I am a second year, as Dr. Wiley said. I have also been a part of that PT and ski program Dr. Wolfrick was talking about, and have had other good clinical experiences that I would love to share on top of all of that, as well as other volunteer opportunities that Shenandoah does a really good job of getting their students involved.
Hey guys, I'm Nicole Balducci. I'm in Juliana's class, but I'm at the Scholar Plaza location. So if you have any questions about that location or the difference between the two, I'd be happy to answer them.
Thanks so much for jumping on the call. Our students make our program great, and we're really grateful for their participation. I'm sure they've had the same kind of week that you've had, adjusting and learning and trying some new things as we all are today. If you have any questions for them, feel free to engage them on the chat. And again, Dr. Bolton is going to be watching the chat. So if there are specific questions that come up, she's going to be moderating them for us. So again, welcome to all of you this morning. So our mission here is to prepare students who are doctorally educated, who are reflective and collaborative, that provide evidence-based, compassionate, and ethical care for the prevention, diagnosis, and treatment of movement dysfunction. You can also see across the global community. I really wanted to emphasize those couple words in our PowerPoint. These are things that we strive for as we structure our curriculum, as we provide our instruction, as we work together. I think they're hallmarks of our program. Our vision is one of providing innovation in practice, of having service to the global community and to our local community, and to look at professional advancement of the faculty and of our students and our alumni. So I want to talk to you a little bit about our curriculum design and how we have our program set up. Our program is a 3-year program. We start in August of your first year, and the first year is basically your foundational sciences. You take a year of histology, a year of cadaver lab anatomy. You take your first research course, your first musculoskeletal course, your first therapeutic exercise course, 2 classes in the professional issues series. And in the spring of your first year, you go out into one of your first integrated clinical experience 1 day a week, which is always really exciting for the first year students. The first semester, of course, can be very rigorous and challenging, but having that going into the clinic in January just really reinforces why you decided to join us and why you've decided to embark on a career in physical therapy. You get the summer off between your first and second year. And in our second year, we have much more of an emphasis on the clinical sciences. So you take an adult neurotherapeutics course, 2 more musculoskeletal courses, your pediatrics course, you begin your research project, and you also have 2 more integrated clinical experiences, 1 in the fall and 1 in the spring. And again, that's 1 day a week for 10 weeks. I think that's a really interesting and novel part of our program. There are other integrated clinical experiences, but we get you in there early, and it's a great opportunity for you to take what you're learning in the classroom and start applying it and practicing it almost immediately so that you can help really drive that knowledge. You do have a full-time clinical experience in the summer between your second and third year. And when you return for your third year, we focus on the advanced clinical practice. You have your last course in the professional issues series, which is a bridge between a student and a novice clinician. You have advanced clinical topics. And you have a couple big projects that you present. It accumulates in December with your oral and written comprehensive examinations, and then our third-year students go into the clinic for 2 12-week final full-time clinical rotations with a graduation in August of their third year. These are some photographs just of some things that we do in class. You can see that's our students after their serial casting during adult neurotherapeutics. There's Dr. Turner working with our virtual cadaver. We do, of course, have full cadaver anatomy, but we also have some technology that's used, including this, this virtual cadaver that can be used. There are some of our students participating on the bottom left in interpersonal collaborations. There is interprofessional education opportunities with pharmacy and music therapists and nursing. We do take our anatomy class with physician's assistants. So we really think it's important to have that interprofessional education embedded throughout your curriculum. And it's also very formalized through Shenandoah University. We have events that take place several times a year. And the final picture on the bottom right is Dr. Bolton teaching a class. You can see the students with some various exercise equipment around them as they're listening to her lecture in a therapeutic exercise class. So again, our clinical experiences are one of the hallmarks of our curriculum. We have the 3 integrated clinical experiences, our 8-week full-time between your second and third year, and your 2 full-time clinical experiences. This is just a picture kind of depicting some of the places you can go. On the top left is a pediatric facility in Maryland. On the bottom left are some of our students and our alumni at a rehabilitation center in Richmond. And on the right is Dr. Wolf Burke with one of our alumni on the right and one of our students who joined him at an acute care facility in Tennessee. We really pride ourselves on having a student-centered education, and we really make the effort to become deeply connected with all of the students in our program. Our goal is to produce a generalist physical therapist who's able to work in any setting. But with that said, we do have some people, we do have some specialists within the curriculum that can help guide you if you have some interest in eventually becoming a specialist in specific areas. We have patient contact throughout the curriculum, but not only through your clinical experiences. For our adult neurotherapeutics and our pediatrics labs, we bring in patients, and you have the opportunity to participate in the examination and patient management all the way through an episode of care over 8 weeks. It's such a wonderful experience, and our second years can talk about that, having finished their 8-week adult experience in the fall semester, and they were able to start their pediatric experience in the spring before, of course, we had to go online. But it's an amazing experience for students to have that opportunity to treat with guidance of their faculty. We have a low student to faculty ratio. We're about 5 to 1, which allows us to spend a lot of time with our students, a lot of time for hands-on and for consultation, for collaboration and mentorship. We are all practicing clinicians. All of us receive 20% release time by the university so that we can continue to hone our clinical skills and make sure that we are on top of what's going on in real life practice. We have specialists in the main areas recognized by the American Board of Physical Therapy Specialists. We have several orthopedic clinical specialists on the faculty. That's Dr. Hartstein, Dr. Lee Avery, and Dr. Bolton. Dr. McVeigh, who's not on the call today, is a cardiopulmonary clinical specialist. Dr. Schrank is an electrophysiological clinical specialist. Dr. Bureau is sports certified. Dr. Devine, who is not on the call, and Dr. Boysonault are women's health specialists, and I'm a pediatric clinical specialist. So you get that well-rounded view of the profession as a generalist and through the specialties with people who have taken the time to really push themselves in practice so we can be recognized in those specialty areas. In addition to the American Board of Physical Therapy specialties recognitions, we have Dr. Wolf Burke, who is a certified adaptive ski instructor. Dr. Lee Avery and Dr. Hartstein also are faculty for the Virginia Orthopedic Manual Therapy Institute, and Dr. Hartstein is a fellow of the American Academy of Orthopedic Manual Physical Therapists. Dr. Bureau has served as a delegate to for Virginia to the House of Delegates for the American Physical Therapy Association. Many of us serve as district and state officers within our professional association. Many in the faculty have been item writers for the National Physical Therapy Exam. That really is a nice advantage for you. Not that we can share the questions with you, but that many of our faculty structure the types of questions that you'll see on assessments and examination in a way that is consistent with the board exam. So it gives you some experience with that type of questioning. Dr. Burke is a credentialed clinical instructor trainer, so she trains the clinical instructors who train you in the clinic, and many of us are also certified clinical instructors. And Dr. Boysenalt is a media spokesperson for the APTA. So I think you can see that many people in our faculty have a wide range of experience, are well known in the field. These are some photographs that talk about that. That's Dr. Bureau up in the corner at the House of Delegates, Dr. Hartstein, and Dr. Bolton presenting. Dr. Bolton presented internationally this year about her research on foot and ankle. And in the bottom corner is our dean, Dr. Karen Abraham, who is a physical therapist, and Dr. Wolfberg, who received a recognition at the Conference for Educational Leadership for their poster presentation. So again, I think that you can see we have a faculty who's really passionate and committed about our profession. We not only we're committed and passionate about our teaching, but we're committed and passionate about giving back and making sure that we're guiding our profession in a strong direction. There are some things that we do in our curriculum that are some fun activities every year. And the first is the clinical conference. And in the fall of your third year, every week, the students and faculty gather together, and students as a group present a clinical case that's focused on managing the case of an actual patient from their first examination through to discharge, and to talk about how they solved the problems, what their clinical thinking was like, what kind of innovative types of treatments did they add to that patient. It's really a great time. We learn so much from our students when they do that, and the students really, it's amazing to sit there and watch our third year students and what they can put together and how they approach patient care. It's very impressive. And that's a picture of one of our students this past fall speaking during her presentation. We also have all of our students at this time participating with the faculty in clinical research. And it accumulates in your third year with a research day where you present your findings. In addition to presenting your findings to the faculty and your fellow students, there are also opportunities to present your findings at international conferences. And I have numerous pictures of this to show, but this is this past year at the combined section meeting. This is Dr. McVeigh there on the left and Dr. Schrank in the middle with two of our students presenting their collaborative research project at that conference. And that's a great opportunity. The university does provide some funding for you to go and do that. And not only have our students presented just those posters, one of our students this year won an award for the best new authorship for an article in the Journal of Orthopedic Sports PT on a project that she worked with Dr. Hartstein and Dr. Lievery and Dr. Fergus on while she was a student. So this is work that can be really important to advancing the knowledge in our profession, and it's a really great opportunity for our students. We use adjunct faculty, and that's because there's so much knowledge and expertise in our area and in our location, and we think it's really important to have these experts come into the classroom and help instruct you. We utilize adjuncts in our GATE lab. We utilize adjuncts through anatomy and in Therex, in the neuro and the pediatric labs. And a lot of these individuals are our alumni, so they really understand our students in our program, and they bring years of depth and experience. We're really proud and happy to have them with us. So why choose us? I like this photograph. It shows our current first year class on the last day of our orientation. We have a really fun and robust 3-day orientation before you start in your first year. This is the picture on the final day where we all get together for a big picnic. And our first years create t-shirts which talk about them. So they draw on them and they can sew on them and paint on them, and they wear them on the last day so we get to know them a little better. So why choose us? Well, first of all, we have state-of-the-art technology. We are using virtual reality so that we can give you clinical experiences. Dr. McVeigh is working with virtual reality to have students have the experience of being in the intensive care unit. It's sometimes difficult to get a group of students into an intensive care unit, and especially, hopefully you won't be standing there when something critical happens, but she has a whole virtual reality experience set up so students get to try that and get a feel for it before going into the clinic. We also have a state-of-the-art simulation lab, and we have simulations again with Dr. McVeigh during cardiopulmonary and I believe in medical fundamentals, so students get an opportunity to hone those skills and get some experience before they go into the lab. We have a biomechanical motion analysis system, so we can look at gait analysis and running. We have a metabolic cart, neurocom, partial weight supported treadmill. We have the virtual cadaver anatomy. We have ultrasound. And I think it's also to note, we also are a university that has the I Am Learning initiative, and our students are all issued a MacBook Pro and an iPad to help them with their learning. I think the students really like that, and they've come in very, very handy over the past week as students access all of their content online right now, but have various ways to do it. And this is just some photographs. On the top left is Dr. Schrank in the motion analysis lab, and there is Dr. McVeigh with the metabolic cart doing some exercise testing. And there's one of our students in the virtual reality lab enjoying her acute care experience. We do have 2 sites, but we are one division. So when you come in, you will decide whether or not you want to be at our health professions building in Winchester, which takes 40 students into their part of the class, or at Scholar Plaza Leesburg, where there are 20 students located. Although that you are in 2 different locations, you are one cohort, and you go through the program together and through curriculum at the same time. Most of the content is delivered via what we call the VTC, the video technology. And you may have an instructor who is lecturing you from Winchester, or you might have an instructor who's lecturing you from Scholar Plaza. All the labs are live, however, with live instructors present, so that you have that face-to-face, hands-on interaction while you're learning those types of psychomotor skills that are so important to become a physical therapist. Some top reasons to choose us. I believe our focus on clinical practice is really key, and our students are very well prepared as novice clinicians to go into the clinic. I think it's good to note that we have over 300 contracts with various physical therapy facilities with more than 600 clinical sites across the United States. And some of those include the Air Force Academy, Shepherd Rehab. We have a clinical rotation through the Indian Health Service on the Navajo Nation. So we have a wide variety of experiences so that we can really tap into anything that you might be interested in as far as where you want to gain your clinical skills. As I've said before, our faculties are leaders in our profession. I would say that we do have an outstanding regional and national reputation. We're a very small school, but people know about us, and they know about the therapists who graduate from our program. We have a unique curriculum and an excellent learning environment. Our students and our graduates are outstanding. I just talked about Courtney, who won the award for being the best new author. Many of our alumni are well recognized in our field. There was an online chat a couple weeks ago about the emerging practices in physical therapies, and one of our alumni, Jennifer Gamboa, was talking about her unique practice and the business that she set up in Arlington, Virginia, to treat performing artists. And you'll see a little later, she gained those skills through this program. I'm going to talk about in a minute our commitment to service, which again is part of our mission to provide global and local service. These are some things that clinical instructors say about our students, and we could probably write 20 slides on this. We get so many positive comments. I think personally, I am also a clinical instructor. I do one of the integrated clinical experiences, and I can't say enough about how professional and prepared our students are when they come into the clinic, how curious and excited they are to see patients, and how dedicated they are to expanding their knowledge. If I would stand outside of graduation and hand out applications for employment from SUPT students because I've been so impressed with your students. I also hear this frequently. I was at a program last spring, And one of the people came up to me and told me that they had an opening in their pediatric clinic. And I said, wow, it's a little early for our graduates. They won't be done till July. And she said, well, have them apply anyway. We'll always hold a slot for an SU graduate, which I think says a lot about our program, that an employer is going to be willing to hold a space and kind of have to stretch themselves a little bit until they can have one of our graduates join them. This is another comment. She is very, very good. SU students are good. This student, like other SU students, is to be able to come up with differential diagnosis and is right there with the rest of us when we are brainstorming a complex patient case. And again, another anecdote I can share with you is one of our students went to interview for an acute care residency, and they asked her a very difficult patient problem with a very tough differential diagnosis during her interview. And she answered the question and she was done. The interview group said, we've never had anyone be able to answer that question. And of course she was offered a spot in the residency. Again, I think that speaks to our preparation and the rigor of our program. This is a picture of our students in the clinic. This was a group that went to Winchester Medical Center last spring, and they very generously took 8 of our students for an integrated clinical experience. And there's the crew one day. I don't believe I've ever had a part-time student looking at the research, so our students are very grounded in research. So this is a little bit about service and a little bit about our adapted sports. I do want to talk about for a minute our really unique program with the PT and ski, and this is a photograph of the students and the instructors getting ready to put one of the patients out on the slopes. This is what we call a clinic by application. It's a program that happens every winter, and Juliana, I'm sure, will be glad to share with you what that program is like. But you do assessment and treatment with the patients to prepare them to go out and do some adaptive sports. There's also all kinds of other service here available at SUPT. We have our Global Citizens Project, which is a really unique opportunity. So what happens with the Global Citizens Project is this is a trip that you can be chosen for. It is at no cost to you. These trips take place during spring break. Students, faculty, and staff write an application about why they would like to go on this trip, and they are chosen, and everything is for free. They've gone to Morocco, they've gone to Singapore, they've gone to Thailand, the Philippines, Puerto Rico, Cuba. There have been so many interesting places. And the idea of the Global Citizens Project is a cultural exchange, and some of it is incredibly unique. We also have a global experiential learning program, and our program is a service learning program, and we have partners in Kenya, Guatemala, Haiti, and Panama. These are some pictures. In the top left is our group with the clinicians at a medical center that we serve with the clinicians in Kenya. And the other 2 pictures are from our efforts in Haiti. We are very careful with our global service. We believe in long-term partnerships. We, in Kenya, the focus of our program is to work in the clinic, but also to provide education to clinicians and do some real formal education. In Haiti, we have ongoing projects with the help and development, with helping them and developing a rehab clinic that's on the ground there in Jacmel, Haiti. And in Guatemala, we partner with an OT and PT program, and we do some education with their students and some sharing in some labs and some treatment. And these are great opportunities. They take place once or twice a year. They're usually about a week long, and you have an opportunity to travel with the faculty and our adjuncts to these trips. Locally, we have an adaptive aquatics program, which Juliana could tell you about because currently she is overseeing that program. And that takes place in Winchester every week, where our students work under the supervision of a physical therapist and provide an adaptive aquatics program. Dr. Wolf-Burke and her husband established an adventure camp for children who have had amputations. And that's another place where our students volunteer for a week or 2 every year. Many of our students are involved in the muscular dystrophy camps during the summer, and they specifically reach out to our program to recruit students. And we also have students who are working at the Winchester Rescue Mission, at the Sinclair Health Clinic, and at Loudon Therapeutic Riding. So we have a lot of things going on with service. And here are some pictures of our students. Top left is at Loudon Therapeutic Riding. The bottom left picture was the opportunity the students took to pack meals during Martin Luther King Day this past year at the big gym over on the main campus of Shenandoah. And on the right-hand side are some of our students who acted as counselors 2 summers ago for the Amputee Adventure Camp. In addition to just service, we really pride ourselves on advocacy and having our students active in growing the profession. And these are some pictures that portray some of the things our students have done. On the top left, these are our students going to an advocacy dinner that are hosted by the American Physical Therapy Association to keep students in touch with what's going on in the profession, and having them kind of have their finger on the pulse of the things that are coming forward that we need to be involved in. On the bottom right is Dr. Boyce-Nault and one of our 3rd-year students who attended the Federal Advocacy Forum last year. Our student attended as through a scholarship from the Virginia American Physical Therapy Association chapter. It was a great opportunity for him to learn how we work on Capitol Hill and how we work with political action committees and how we work with legislators to make sure that physical therapy is recognized in the forefront. These efforts have been really important during the past week. One thing that you might hear about, as you know, as we're doing right now, is this idea of telehealth, telerehab, and the efforts of physical therapy advocates through the American Physical Therapy Association have made sure that our services are reimbursed under these types of models because they're so crucial right now. And we help train our students to be aware of these kind of things that are going on in the professional environment. So graduation and beyond, this is on the main campus. There's that SU sign, and there's traditionally always a picture of the class together before graduation out at the sign. So I think this is an important thing for anyone who's looking at a program to consider. 100% of our students have passed the national board exam, and a small percentage don't pass on the first try, but 100% who've taken it have passed, and that's important. So here are some of our metrics. 95% was the first time pass rate in 2017, 94% in 2018, and 97% in 2019. And again, we have a 100% overall rate. And it's really important that you start looking at those averages when you're applying to a school, because you can get through the whole program, but if you can't pass that final examination for licensure, it's going to make your professional life very difficult to get off the ground. When we talk about that it's a 95% pass rate, when you're talking about a class of 60, it's probably only 1 to 2 people who will not pass on the first time. And if that happens, we provide lots of support to make sure our students are able to get stronger in the topics they need to be to pass that examination. We have 100% job placement of our graduates. And I think it's important to note, because employment of PTs is expected to grow through 2022. And we're really glad that we have that strong job placement rate. We work on that during our 3rd semester, when we have an interview day and we have resumes and a job fair every year, so students feel well prepared to go out into the job market. This is just a little bit about earnings, about medial annual earnings of PTs, around $85,000 per year. Our students come out around, they're making about $72,000 to $75,000 per year, which is, you know, a nice salary coming out of school. So not having a PT degree enough for you, we have several really great programs. If you want to be a DPT and an athletic trainer, we have a dual program where you can earn your master's in athletic training. That is available only at the Winchester campus, because you have to put in time with the teams on the field. But Corinne is here and she can talk to you about that a little bit more. If you want to become an administrator, we have a program where you can earn your DPT and get a graduate certificate in business essentials, which is a 15 credit hour curriculum that talks about accounting and marketing and economics and finance, so that you can move to those more administrative roles that have those competencies required. If you want to work with performing artists, we have a performing arts medicine certificate. It's 15 credits, and it begins in your 2nd year. There are many students who have gone through this, and it's been really, again, a great opportunity. Shenandoah is known for its conservatory with its singers, dancers, and performers, and this is such a specialized area and such a great thing to be involved with. Again, for our one graduate, it was kind of the springboard to her for her private practice and how she looks at things. Some of our students who have gone through this program have centered their research as students in that area and have moved on to present internationally about their findings. It's a really good program. We also have a School of Public Health, and we have several certificates that you can look at, an online certificate in population health, which I think is really dovetails nicely in with physical therapy, as we as professionals look more at population health and our role in population health, and that's 12 credits online. We also have a public health certificate. Again, this is really dovetails nicely with physical therapy as we as a profession start looking at our larger role in the community, and that's an 18 credit online certificate. And you can also earn your Master's of Public Health along with getting your DPT. Again, you can do it part-time and it's delivered online. So these are great ways to really even beef up your resume along with having a DPT. So just some things about applying to our program. We do it, of course, through the PT CAS. You can have a bachelor's in any major. We look at a minimum 2.8 GPA. We don't have a minimum score for the GRE, and we require 40 hours of observation, and multiple settings is advised. So for us, I think it's really important that you get a sense of the whole range of the physical therapy profession, because when you go out to do your clinical rotations, you might have only seen things in an outpatient orthopedic setting, but then you might have to do a rotation in a skilled nursing facility or in acute care. And I think it's good for you to know that all of those opportunities are out there. Our application deadline is October 1st. We then look through our applicants and we have interviews in November and December. You're invited face-to-face to our campus for an interview with faculty and students. And then we notify our people who are accepted into our program in late December, early January. This is just some metrics of our classes that have recently been admitted. You can see the most recent one we have the documents for the data for is a GPA of 3.59 in the prerequisites, and overall of 3.61, kind of in the middle percentiles for the GRE. And back in 2017, we had 933 completed applications. So who do you contact? Dr. Turner is the chair of our admissions committee with Dr. Hartstein, so you can definitely reach out to them if you have specific questions about how to strengthen your application or questions about what we accept and what we don't accept. And then, of course, there's Linda Burrow, our admissions coordinator. She is amazing, and she will always get back to you and give you great information about prerequisites, whether or not she got some paperwork, and about how anything you need to know about our process. I also wanted to make sure that you could see a slide for our Office of Financial Aid. This is how you can reach them. You can also find them online if you go onto the Shenandoah main site, and they can tell you a little bit about how you would pay for your physical therapy education here at Shenandoah. And they're still on the job virtually while we're online. So I'm going to just play this real quickly. I don't believe I have the sound on. I think it's unfortunate, it's just the way it is right now that you can't come and see our campuses, but this is a video that was created for our physician assistant program, but there are a lot of pictures of the physical therapy program in it, and I wanted you to take a look at it. So let's take a quick look. I don't have the sound turned on just because they're going to be talking about PA, but I'm going to narrate a little bit of what you're seeing so you can get a sense of it. So that's one of our classrooms in the PA program. That is our health professions building from above. We have a new, they made a new addition to that building. That's the health science building on main campus. That's the Winchester Medical Center, where we have many partnerships. That's more of Winchester Medical Center, and that's the city of Winchester, which is a lovely little town, lots to do there. That's the Inova Hospital. That's Inova Hospital Loudoun, which is located right next to Scholar Plaza Leesburg. And there's Loudoun County, where our Scholar Plaza site is located, 35 miles from the District of Columbia. And that's the Health Professions Building. And some pictures of our labs in there. Some of our activities with children, our motion analysis lab, one of our classrooms. That's the gym. In that picture, you could see, and there's a better picture later of the video technology. That's one of the simulation labs. That's the library on main campus. That's Scholar Plaza Leesburg, and there's some of the classrooms there. That's again, students working. And there's some of the video technology you saw there up in the corner. That's our workout room. There's video technology being used to teach a class. That's students at Scholar Plaza watching. So just to give you a sense of what our facilities look like. And once we're back open to the public again, we certainly welcome you coming over for a visit. Even during the summer when our students aren't there, faculty are available, and we're happy to take you on a tour and show you our facilities. So now it's time for questions.
So I'll direct all participants to the chat box. It was that second screen that you saw where you can see the like the little quotation, 3 dots there. So feel free to ask any questions. I know it was a ton of information. If you need us to go over something again, I'd be happy to review that too.
I'm going to turn on our faces because it's nice to see who's out there, to see who's on video. I'm going to stop the share. Hi, it's nice to see you all.
So we have a question regarding when will Shenandoah's program become available on PTCAS? And that's a really good question that perhaps Dr. Thomas Turner can give a better description of that. I believe it will happen in the later part of the summer, but I would definitely like for Dr. Thomas Turner to answer that if he's still on. And then Dr. Wiley, do you have any idea of exactly when it comes available on PTCAS?
I do not, unfortunately. Dr. Turner is, I see he's still on the call, but he might be, as
It's
you
typically
all,
around July 1st, I think.
Yeah, that's what I thought too.
Dr. Turner we can confirm that, but I'm pretty sure it's usually around July 1st.
Right, in the summer. Thanks, Dr. Hale. Appreciate that. Thanks, Kaylee, for the question.
Does anybody have a question for one of the students? I know that, you know, they can really give you the best reflection on what our program is like and what it's really like to be here. Would you please go over the calculated GRE score that were averaged from the accepted students? Again, that's more of a Dr. Turner question. Dr. Hale, do you have any insights to how those are calculated and how those are done?
Well, it's just based on when you take the GREs, you have the 3 components of the GRE, and for each score you get a raw score and then a national percentile. And so what we're reporting is just of all of the students that were accepted into our program, we average for that incoming class, what was the average verbal score, what was the average analytical score, what was the average written score. So it's just a straight average. If that's not answering your question, let me know and I can clarify.
I think I'd like to share something too that Dr. Turner always says. You know, I think sometimes you see those average scores and you feel a little intimidated. Apply anyway. We do a very holistic examination of your transcript, of your observation hours, of your references, of your experiences. So, you know, the GRE is just one part of it. So don't feel like you have to take that GRE like 5 times to get to that certain mark.
Thank you, Dr. Wiley. We have a question for Corinne. Corinne, how is the workload for the dual program in DPT and AT, and do you find it challenging?
Ooh, what a great question. So the workload for the DPT and AT, I would say they do a pretty incredible job splitting it up and introducing yourself into the program. For the dual program, it is an extra half a year for you to get your degree. So we start in the summer versus in the fall. And this summer, I actually have to stay here and take more classes. Fingers crossed that I can do that. So this summer, I'll actually be here while all the students are away. So the athletic training students and DPT students that are duals have a little bit more time on campus. During your first semester as a PT and first semester as an AT, they introduce just an AT curriculum and then just the PT curriculum. while we do have just the PT curriculum, we're also involved in an athletic training. Sorry if I'm talking too fast. I'm a fast speaker. In the AT curriculum, they do have a clinic during your first semester as a PT. So it is a little bit hard at first to get the balance between how much time do I put into PT, how much time do I put into clinic. What's super helpful is that it's a very small group of us that are dual students. So we really rely on each other to keep each other going for the most part. So for example, for assignments for PT, we're constantly like messaging each other like, hey, don't forget this is due, and same with AT. So it is a little bit more challenging. You have a lot less free time than some of the other students. You kind of feel every once in a while we'll feel a little bit drifted, but they do a good job of like keeping us involved. But there are a lot of events that you miss with just PT. But for workload wise, all of the professors do an amazing job working with us, and you have your group to keep you on track. Hope that answers your question.
Great, thanks so much, Corinne. So we have a question from Austin regarding various clinical placements for observation hours and potentially the inability to go to a different clinic due to COVID-19. And I think this is a really good question. It's a really now question. And so with that being said, there is uncharted territory that we're all in right now, and we have to understand that, and we have to appreciate that. And so very much like Dr. Wiley mentioned, we take a holistic view of our applicants. And so, you know, potentially you'd say, I had this set up, but it was not available or not accessible due to COVID-19. And so maybe having a backup plan or some idea of what you may do even after you've submitted your application may be helpful for us to know. Also, we understand limits that the coronavirus has put on for observation hours. And so again, we'll take a look at the whole picture and not just those observation hours. And if it's any consolation, I am talking to Dr. Aaron Hartstein right now about this question too. And he mimics the topic that we take a holistic view and understand that that is one part of your application that you can't control right now.
Dr. Bolton, can I just add to that?
Yes.
Another thing to think about for all of you as you're trying to do this, and I'm not saying that every school is going to accept this, but the idea of the observation, like Dr. Wiley alluded to earlier, was so that you're familiar with the different practice settings and it's nothing you've never seen before or weren't aware. There's so many opportunities online to learn about, you know, online or acute care PT and, you know, different videos through the APTA and simulations. So if you're really concerned that, wow, I don't really know much about acute care, or I don't really know much about inpatient rehab, or what do pediatric therapists do, use resources online or feel free to reach out to us and we can try to connect you so that at least you've had exposure and you can speak to that and it's not totally foreign territory. And again, I'm not saying every school is going to accept that in lieu of ours, but if you really want to enrich your experience and exposures, that might be an alternative.
Sherry, I think Dr. Hale, those are great recommendations. So we have a question from Samantha, and this is for the students. So students, do you feel like didactic and classroom lab work has translated well to the clinic, and do you feel comfortable in the clinic with patients?
I'm Caitlin, by the way. I didn't get to introduce myself at the beginning.
Oh, sorry.
It's okay, Dr. Wiley. I just wanted to say, I'm a first year, and going into a clinic as a first year is really intimidating. You don't know what to expect. You don't know if you're capable of doing what your CI wants you to do. But I can tell you 100% that I felt prepared, and I was surprised by how much I knew once I got into the clinic. And it was because of my didactic time between lab and lecture. All of our professors do such a great job at incorporating what we learn in lab to lecture and what we learn in lecture to lab. And so going in, I was scared, but I felt so much more comfortable. And working with my patients, because once I was able to talk with my CI, so my clinical instructor, I realized that I was very capable of doing what they were asking. And in just one semester of PT school, the program prepared me enough for that. They make you feel comfortable to step into the clinic and do what you really want to do. So it was great.
Thanks, Caitlin. I really appreciate that response, and I think that it's very helpful to hear that that's coming from a first-year student too, somebody that is, really just getting into their skill-based courses too in the spring semester. So we have a question from Jane on the application. Is there anywhere that you specify which campus you would like to attend? If not, how is this determined? There is a distinct question on the on PT-CAS application, so Physical Therapy Central Application System. And on the application, you would select if you would like to go to the Winchester campus or if you would like to go to the Scholar Plaza campus. And so there is absolutely a way to designate that on the application. Very good question. Kelly has a question going off of one of the photos. Can you go into more detail about the video / projected learning between the campuses? How often is this streaming utilized and for what classes? And Kelly, I think this is a great question and something that we're very thankful that this open house can go over. So the technology is called VTC, which stands for video teleconferencing. And what happens is between the two sites, so between the Winchester site and the Scholar Plaza Loudoun site, your faculty will present via video teleconference. So perhaps Dr. Turner is lecturing for histology from the Winchester campus, and that would be video teleconferenced over to the Scholar Plaza campus. And so since he's primarily housed at the Health Professions building in Winchester, compared to myself, where I'm primarily housed at the Scholar Plaza Loudoun campus and I teach anatomy. Anatomy would be primarily taught face-to-face with SPL students, but then video teleconferenced over to Health Professions building. Now, we alluded to that the faculty go back and forth between campuses throughout the semester, and that is absolutely something that our faculty do well. They make sure to have face-to-face contact with all students. Now, that's just lecture. Labs are not that way. So, for example, there is HPV or Winchester students have their own cadaver lab on main campus. Scholar Plaza Loudoun students have their own cadaver lab in the building. All musculoskeletal and therapeutic exercise labs are with core faculty members, and those are not video teleconferenced. But primarily in that first year, when it's more of those foundational sciences, you see that there is a bit more video teleconference a model, and then that kind of dwindles as we go through the second and third year, more of those clinical courses that are more lab-based. And again, if I'm not answering your questions well enough, please chat. We definitely want to make sure that your questions are answered. We have a question from Madison. Are there job opportunities such as a TA or GA within the program? And so to answer this question, right now there is, as far as I know, there's been talks with exercise physiology program on main campus regarding students participating in their labs, and perhaps Dr. Wiley or Dr. Hale can put in more information here. But as of right now, for the program in particular, there is not. I can say that from a bigger goal, strategic view of the School of Health Professions, we're definitely looking into those opportunities. But for right now, with physical therapy, I cannot state of a particular TA, GA position. What I can speak to, though, is our students, our second year students that are tutors. And so the tutoring program at Shenandoah is fairly robust. And so we have second year students that tutor the first year students in those ology classes generally. And that is a paid position through the university, and that is generally faculty selected. And we have a question for Evan. Have the recent graduating classes trended towards a particular field? I love this question, and I can't say that one particular class, or our students go to any one field in particular, which I find great. I think the overall, if you look at all physical therapy, I think it's about 75 to 80% of all physical therapists generally practice in outpatient clinics, generally practice in, outpatient orthopedic. And so that's just the baseline of our profession. And likely our graduates follow a very similar trend. However, I think we have an amazing pediatric and neuro curriculum that I always see so many students going into pediatric careers or neuro careers. We've had students that have been accepted into acute care residency programs, into neuro residency programs. And so really the spectrum of physical therapy overall, you see our students going those routes. So can't say that we're just ortho, or just neuro, or just peds. We're really the mosaic of physical therapy. But good questions. I like tooting our horn. From Kayla, how do students determine which campus to attend? That's a really good question. I think that's often a personal decision. Generally, students have the ability to visit both campuses. They can visit the Health Professions Building in Winchester, in the town of Winchester. They can also venture out to the Leesburg area. And so sometimes students base it on the fact that they have housing already with family in a certain area, and that's how they determine. Or sometimes students are like, well, I like the concept of like a bigger class size of 40 students, or sometimes they say, I like the smaller class size appeal. Again, one cohort, but generally you would be only with those 40 or those 20 on a daily basis. And so I think it comes down to more of a personal decision. In addition to that, if you're interested in more of the dual program for athletic training, that may dictate your preference on campus, being that it's a primarily Winchester-oriented program. Does the Winchester campus, this is from Angela, does the Winchester campus have a partnership with local fitness center for any classes? So as far as I know, that there's not a distinct partnership with any local fitness center classes. There is a gym in the Scholar Plaza Loudon facility, as well as the Health Professions Building. Students generally, like for example, Caitlin Goodhart, she's hosting a Zoom yoga class at 11:30 today, and I'm going to join that. So students are always willing to provide their own classes, or students are instructors at various fitness centers around their potential campus. And so you can always go to those. The Health Professions Building and Scholar Plaza Loudon, their building management generally creates like a Zumba class or like a HIIT class that students can participate in once a week. And so while there's not an official partnership with fitness centers, there's definitely the ability to get your fitness on. What's the average commute for students? I would say that this varies a lot. And so theoretically, off the top of my head, when he first asked that question, I think about students in the Northern Virginia area and having to commute into Leesburg. And so I could potentially let the students answer this question too. So often I hear of a bit of a longer commute for students in the Northern Virginia area because they may be living at home and commuting from their parents' house to there, or they may have an apartment a bit off of the Leesburg region. But I've also heard of students in the Winchester area that commute as far as from like Hagerstown. We've had students even commute from the southern border of Pennsylvania into Winchester. So I think that's really pretty variable. But in addition to that, we have some students that have a walking commute, and they have a 10-minute, 15-minute walk to campuses. So I think it's all pretty variable. A question from Kayla. Is the SUPT Thrive program overlooked by the Global Citizenship Project, and what is the application process like for this? And I think, Dr. Wiley, I'll let you answer this question regarding Thrive and global experiences, since that's pretty much your forte.
Sorry, I muted myself, Dr. Bolton. I'm the chair of our global health initiatives in our division. GCP is totally separate from our division and totally separate from Thrive. That's a university endowment for these cultural exchange trips that anyone in the university can participate in. So if you are selected for one of those trips, you could be with undergrads, graduate students, administrators, staff, other faculty members. That application process, as a first year, it kind of hits you really fast because it's an essay and it's due like the second week of September. They make a selection process sometime in October. You're notified if you're selected. Typically, we get 1 or 2 students from our program every year who are selected. In November, they have a big gathering of everyone who has been selected for the GCP, and there's the big reveal because you don't know where you're going until they tell you. So then they give you the reveal and they start working with you about getting you ready to go. Again, the cost of the program is free. I think the only cost that you might incur would be like food in the airport and the cost for your passport and things like that. Thrive is a totally different organization. Thrive is kind of evolving right now, and it's a service and global health organization. But I want to be clear, when we're talking about global health in our division, we're also talking about local. So Thrive helps with the trips to Guatemala, to Kenya, and to Haiti. There also have been some newer initiatives this year of doing some service with remote area medical, and some students may be going on trips with them where they'd be serving somewhere here in Virginia for a weekend with underserved populations. The Thrive trips are done under the auspices of the Global Experiential Learning Office. So they're actually a class. It's an elective class. It's taken for 1 credit, pass, fail. And that was done for a lot of different reasons, but if you really want to take one of these trips, it's also an opportunity that you can use your financial aid since it is an accredited course. Yeah, so that's Thrive. And the Thrive still operates as an organization. They also help take care of our Martin Luther King Day service and developing some other service paths too. So I hope that answers your question.
All right, thank you, Dr. Wiley. I knew you'd be the best person to answer that question. All right, so we have a question from Samantha regarding GPA. If a prerequisite class is taken twice, is the higher GPA taken? And this is a really good question. So the answer to this is if that prerequisite class is taken twice, for your prerequisite GPA, we would count that higher grade. Okay. However, both classes are factored into your overall GPA. And so while it may help that prerequisite GPA, again, both of those grades are calculated into your overall GPA. All right. Do you provide learning assistance for students who may be struggling? And that's a really good question. And the answer is yes. I can't tell you how many numbers I have kind of on speed dial for resources for students, for whether it be for study strategies that they may need, or if they need any type of accommodations. There is an entire center based at Shenandoah for student success. And so I can definitely send out the link. There are so many resources about study strategies, about exam taking strategies, about undergraduate versus graduate learning. So there is a plethora of resources. And whenever a student has a question like this, I definitely send them to the Office of Student Success. And so there are robust resources, not only for students, I use them a lot for myself to be able to aid my advisees. And so just there's a great robust center for that at SU. Question from Kaylee. Will there be an opportunity to receive a copy of today's presentation / open house PowerPoint? And I think the answer to that question is yes, Dr. Wiley, and I can send this PowerPoint out. In addition to that, this webinar or this open house is being recorded. And so our plan for right now is to take this recording and be able to post it online so that it would be accessible to those individuals that were not able to make it today. Thanks, Caitlin, for chiming in. If anyone is out of state and has questions about housing, Caitlin's happy to answer those. Specifically, Caitlin is at the SPL, the Leesburg-Loudoun campus, so if you're interested in that, please definitely reach out to her. In regards to taking prerequisites, does Shenandoah take credits from classes taken from community colleges? That's a really good question, and the answer is yes, we do. So sometimes we'll see that students will take prerequisite classes from community colleges, and we'll factor those prerequisite GPAs from community college classes into that prerequisite. Yes. Please share your email. Dr. Wiley has, Caitlin Bozick, she's a student at Scholar Plaza Loudoun, has. Another question. How often do you attend class for working adults? How many classes are online? I have had previously shadowed a PT for 3 months over a year ago. Do I need to have more recent observation, or can I go online for additional up-to-date information? How often do you attend class for working adults? I might, Michael, I might have you help me out here with this question. How many classes are online? So right now, for our programs, obviously all of our classes are online, as pretty much all of the universities across the US. And so what's fascinating is we thought that some classes that would never be able to go online have been. And so that's been fun for us. But pre-COVID-19, all classes were synchronous. Students came to campus. They would sit in their classrooms together. They would have a lecture face-to-face or via video teleconferencing. All labs would be live. And so the expectation is that the student would be physically present during the time of class. And so that is the expectation that the program has. There are a few different models within our program that I can speak to. So there is a purely online course for our third years about building your own PT practice that Dr. Ed Schrank leads for our third years that are in their full-time clinicals. So they're in their full-time clinicals, they're working as a PT student, and then they're taking that class purely online. There's also what's called a flipped classroom model where, so anatomy is considered a flipped classroom model where I podcast all lectures, students listen to those lectures, and then we have an application time where students can ask questions about anatomy. And then in addition, there is lab time. So lecture is not live for anatomy, but it is podcasted. And then in regard to, I've had previously shadowed a PT for 3 months over a year ago. I think that those hours should be fine. I would say within, and maybe the admissions committee can answer this better for you, Michael, but I would take that observation as being absolutely fine. We know that students probably span out their observation hours. Hours are hard to get sometimes. And so a year ago is seemingly no problem to me at all. You would not need to have more recent observation hours. Hi, Bella here. Can you explain more about the cadaver lab? Do PT students get to perform cadaver lab dissections from start to finish? I understand this class is shared with the PA students. Can you elaborate on that? I can. So the cadaver lab course for us is really unique, specifically to our to both the PA and the PT professions. It's an entire year of cadaveric dissection. We receive donors from the state anatomical program, and students do all dissections. And so from the very start to the very finish, full skin reflection, there are no prosections, meaning that nobody has dissected the donor before you have. And so it is a very neat, medically oriented anatomy. And again, it spans over the year. So students definitely do all cadaveric lab dissections. And then again, this is with PA students. And so what students will, there'll be generally like 2 PT students, 2 PA students to a donor, and then they work together as a team to help dissect that part of the donor. So really good question. Again, there are cadaver labs at both campuses. For health professions building, there's not a cadaver lab on site, so students in Winchester actually have to travel to via car or bicycle to the main campus, and that is at the Health and Life Sciences building. That is HLSB, and that is on main campus, whereas at Scholar Plaza Loudon, there is an anatomy lab on the 4th floor. All right, so we have a couple other students willing to answer questions. What is the interview process like for possible upcoming students? So the interview process is obviously you go through the PTCAS, you submit your application, and then generally about 250 students get accepted for an interview. And those 250 students that are accepted for an interview will come and interview face-to-face with a faculty member and a student. And again, that's a holistic approach. We want to know you in the 3D. So we've seen your application, we've seen your marks on your paper, but we talk about potentially, why did you want to get into the field? What observation hours have you had, and what have you learned from it? And so it's a time for students to come in to meet us to make sure that we're the right program for them, and then a time for us to meet them as well.
Do any of the students want to chime in on their interview experience?
Thank you, Dr. Hale.
If you have something to add, if you don't, that's fine. But I don't know from a student perspective if you took something away from the interview that maybe we aren't highlighting.
I'll say something. For the interview process, I actually was an out-of-state student, so I'm from Florida. So for those who are coming from out of state, if anyone is, I think the interview process being in person was extremely important. I thought it was absolutely incredible to come in and actually see the campus and meet the professors and meet the students, because it really spoke to you if you would fit in there. I think for any campus that you apply to, if you plan on attending, I think visiting the campus is the most important thing, even if it does require going through plane tickets and all of that.
Thank you, Corinne. I think you gave a really good perspective on that as well. Okay, one more question here. Are the cohorts primarily recent graduates from undergrad, or are there some students who are going back to school after working for a few years? I love this question. We have students in many different stages of life. We have students that are new grads that have recently graduated, took no time off, and went right into PT school. We have students that have taken several years off, maybe worked as a physical therapy technician or aide, and they gained hours, and then they have come back to or go to DPT school. So they've taken a few years off, maybe done some PT tech stuff and prerequisites, and then come back to school. We've had career switchers. One of my good friends in the program, when I was a student, she was an IT specialist, and she completely switched careers. She had been working as an IT specialist for, I think, 8 years, and then left that career and completed prerequisites and came back to, or got into PT school and chose that route. Currently, we have students that, again, are career switchers, students that are husbands, wives, parents. So really, it's a whole board of that.
Dr. Bolton, Kaylin didn't come right from undergrad, if I'm correct. Do you want to speak to that, Kaylin?
Sure. So I actually graduated from Virginia Tech with a degree in political science, and I spent quite a few years working in politics in Washington, D.C., and then I decided to leave my current job there and transition into taking prerequisites at night, and I worked full-time as a physical therapy technician, which I feel like was really beneficial doing that prior to going back to school. And now I'm full-time with the Shenandoah program, and I'm very pleased with my decision. It actually was my passion prior to going into political science with my undergraduate degree, and I'm glad that I kind of looped back around and went to back to my initial passion. Very pleased with my decision. So if you are one of those people thinking about making the change, please feel free to email me. It's the kbosick18@su.edu. And again, I'm at SPL.
And real quick, if I chime in, I'm not the same as Kaylin. I didn't I graduated with an exercise science degree, but I decided to take a few years off before coming into PT school, just for a little break for myself, but also to just get more experience. So I started to work as a tech at a physical therapy office, just to build my experience and really ensure that this was what I wanted to do. And the faculty, it's not held against you because you took some time off at all. They appreciate all of your experience and what you have experienced in life before the program. So I think that's really great. So whether you're fresh out of undergrad or you're from a few years off, you're all welcome into the program, which is great.
One thing that I also noticed was I am from the very opposite, where Shenandoah has a program that's 3+3 that they're kind of integrating and changing a little bit now. But I came in, hadn't even gotten my actual bachelor degree yet, and I was very nervous that people who had gotten that real life experience would be at different stages. But what they do that first semester is really put everyone on the same page. We do not feel like, oh, well, you have had more experience as a tech, so you know more than me, or something like that, but rather we all get to get the same facts together. They kind of take us down. If someone does feel like they know more, they're like, okay, let's start you at square one practically. So it was really helpful to know that that's the way that they integrate the program for us all.
Thank you all for chiming in. I think it's wonderful that we've had a good spectrum of students on here to be able to show the variability in the cohort. Let's see here. Is there a specific person to contact about the DPT and MPH program, or is there a specific place to look for more information on the website? So this is a good question. I will put, so the director of Public Health Division is Michelle Gamber. And just as a clarification, the MPH program, while it is the Master's in Public Health, while it is delivered online and part-time, the courses are not considered, like, it's not a dual program like the athletic training and DPT program is. It is a separate program. But let me go ahead and in this chat box right now,
I'm sorry, I put a link in there. It's the wrong link. I'll put the right one up. Don't you worry about it, Cameron.
Okay.
Just to clarify, sorry to interrupt, you don't have to be an SUPT student to enroll in that. So keep this in mind, even if you decide, you know what, PT is for me, but SU is not, and you decide to go to another PT school, this is open to anybody. So please, consider it no matter where you decide to do PT school. And if you think, you know what, I don't want to do this while I'm in PT school is plenty for me. It's open to clinicians as well. So it's not something that has to be synchronous with our program. This is open to everybody across the country. Feel free to share it with maybe people that you've been observing. It's not just for Shenandoah students.
Thank you for that, Dr. Hale. That's absolutely right. It's a completely separate program than PT. And so anybody that has interest in public health or population health can look into those certificates as well as the master's program. How does the DPT integrate with my master's degree in exercise science? I think it's a really good question. There are obviously prerequisites that include anatomy, histology, chemistry, physics, exercise physiology. And so I think that potentially the master's degree in exercise science may assist you in that doctorate level course load. And so you could potentially think of that master's in exercise science potentially being a good bridge between a bachelor's degree and the doctorate degree. How should grades be sent over after application? I know transcripts need to be verified by application time, but how should we submit grades achieved after the fact? that's a good question and something I'm absolutely going to direct you to Linda Bureau. She helps with admissions for the physical therapy division. And so her contact information was on this webinar. It's lburrow@su.edu. She's the go-to for any type of question like that. And generally, from what I know, you send information to her and then she kind of revamps your application with that information.
Dr. Bolton, let me chime in just a little bit
Yes.
from admissions committee. Linda Burrow, and that email you gave is a great contact because she will really kind of help coordinate all of the application processes you're going through outside of what PTCAS does. You know, PTCAS handles all the applications. So anything dealing with stuff that you submit to PTCAS, that's usually the first place to go for any corrections or fixing it up. But to get to that question, as far as adding grades, once you've submitted your application, there is what's called a chance for you to academic update. That happens at the end of the fall semester, usually right opens up late in December, and it allows you a chance to enter your grades from the fall semester. And you really need to do that to get your application updated and to include any of those grades in your overall GPA calculation. And so PTCAS manages that. You don't send that to us. You send that there, and then they verify that just like they've done all the other courses. So you do that for in the end of the fall. At the end of the spring semester, if you're still taking courses, I guess it won't really matter to you guys if you're applying this year. But there's not an academic update at that time. Then you'd send transcripts to us, and we would kind of fix up the overall GPA. But usually by the time the spring has come, we've had selected students. So at that point, we're just verifying that you have the courses that you need and that you've completed them.
Thank you, Dr. Turner. All right. Where am I on the chat? All right. When is the next open house, or do we have cadaver lab tours? I'd like to visit campus. I may have contact of concern person for international student, please. Yes. So right now, and Dr. Turner, please correct me if I'm wrong. I think we have potentially a June open house. And so that's the plan right now. I think we are keeping with that plan until we know otherwise from the university, given the fact that our lives and our schedules are changing every day due to COVID-19. And so right now, the open house is in June. And for cadaver lab tours, Dr. Turner and I welcome cadaver lab tours. But right now, our university is closed through the end of the semester. And so we cannot go into the labs during that time. Part of the open house is a tour, though, of the associated labs, so you would be able to knock both of those out with one tour.
And then also, Dr. Bolton, you know, the anatomy lab is not within our main building at the health professions. It's across town, 5-10 minute drive. But because we hold the open house at the health professions building, it's not typically easy to get everyone to cohort over to the other part of the campus to do a tour. Something certainly we could consider if we do open up or when we do open up. But, you know, just as a biased person and one of the co-coordinators of the course, I can tell you it's a state-of-the-art lab. You won't find a better lab there. We designed it from the ground up and put in all of the things that are necessary for appropriate dissection. And so even if you don't see it, I know it's just my word, but it is one of the best labs you'll ever go into.
I will second that, Dr. Turner.
And know too that once the university opens back up to being on campus, I mean, we're open, but just everything online. But once we're allowed back on campus, you all are always welcome to come and visit. Our doors are always open. You can anytime reach out to one of us or to Linda Burrow, and we can schedule a tour for you of whatever facilities you want to see. So don't ever hesitate. You're not restricted to open houses to come and see us. We'd love to see you any time of year. Just reach out and we'll set up a time to welcome you to campus.
All right, so a couple more questions here, and I think I'm going to let the students answer this one. What are the class hours like during the week for a student? And does this change depending on what year you are in the program? And we have first and second year students, so I'll let them answer this question.
Okay. So it's funny because I have a friend, well, actually, one of my roommates is a first year, and then I also live with a second year. But the difference between the two, um, first semester specifically, you get eased into it a little bit more. So class hours are really from maybe 8 to 3:30 with a few breaks within there. Also, as we've talked about, getting over commuting to the cadaver lab if that is needed. So classes are about maybe an hour and 20 minutes for one class period or something. And then you have a little bit of a break depending on the day. And then as first semester or first year, second semester rolls around, the schedule seems to get a little bit more rigorous, and you are in class more like from 8 to 4:30 or 5, depending on the day. Second year is a lot of group projects. So on top of being in class from 8 to 4:35-ish, we are doing group projects after class. So people sometimes stay on campus from anywhere from 6 a.m. to 11:30 p.m. or something. So it just depends on what rolls with your schedule, how you make it work with your group members, with your friends. And we do have a lunch break, which is good, because that is definitely necessary just to get outside, to just take a break from being in the classroom, because a lot of the days we are just sitting down, and we definitely need to get moving to keep our minds going, because it is a lot, and you have to kind of just get used to that new schedule of, okay, we are sitting in class for 8 hours a day or something. During the clinic days, those are completely different and completely dependent on your specific clinic. Like some that are traveling for home health, they're in the car for some of the time, but others are a quick commute to the hospital, and then you're there from 7 to 3 or something, for example.
Thank you for that, Juliana. I think that's a really good example of the variability in scheduling. So appreciate that response. Last question here. How many outstanding course/credit hours can someone have when applying to the program? And I can't say that I know off the top of my head an exact amount, but maybe Dr. Turner, if you're available, you could answer this. And if not, then we could likely get back to you regarding the answer to this question. Yes.
If Dr. Turner does not chime in, I think, and we can confirm this and get it back out and post it when we send the PowerPoint, but I think you're allowed up to 3 outstanding, and some of the students that are on here may actually remember from when they applied, but I think you're allowed 3 outstanding prerequisites at the time of application, because more than that, it just becomes too difficult to calculate your GPA. But we can confirm that, and again, feel free to reach out to Linda Burrow, Dr. Turner, and Dr. Hartstein to get more information about application.
Thank you for that, Dr. Hale. Do the group projects include students from the other graduate programs at SU as part of the interprofessional learning, or do the groups include participants from the DPT program only? So this is kind of a two-part question. The first is, segues really nicely into talking about our interprofessional education curriculum that is within our graduate schools. So the School of Pharmacy, School of Nursing, School of Health Professions, and so various programs come together 4 times throughout their entire curriculum given their program. And there are it's a group like scenario, they have discussion, there's a topic for each one of those workshops. And so that is something that each program designates time to a few times in their curriculum to do. So that's not necessarily a group project, that's just an opportunity to come together with various other professions and talk about a leading topic in the healthcare world and how your profession would tackle it versus another profession. When there is assignments that are due for DPT courses, that would be strictly with the DPT students. However, there is that one exception of the PA and PT groups that work together for anatomy lab. There is an idea that participation your participation grade is from your group effort. So that would be the only exception to a group project being with another healthcare division.
Can I talk a little bit about the interprofessional learning a little?
Please.
I would say that's actually one of my favorite parts of SUPT is the opportunities that we have to work with the other professions. Since we are in the same building as PA and Pharm, and we have the chance to work with PAs. I actually find myself hanging out with a lot of PAs, and I think having that connection for when I graduate will be extremely beneficial. I absolutely love the fact that we're all able to work together. I'm also part of one of the foot clinics. I help organize the foot clinics in the area, and that's another great way to get the interprofessional education with that. So we have the chance to work with Pharm and PA in those opportunities. I really think that's a great way to become the best clinician for yourself, because you can hear about what Pharm has to say and like get a Pharm perspective rather than just taking a Pharm course, or get a PA perspective rather than just taking a course about anatomy. So you really get a lot of different perspectives in the healthcare field, and I think that's a really great thing that SU has to offer.
Thank you, Corinne, for pitching in that. Are the course hours daily or several times weekly? So courses generally do not meet every day in the DPT curriculum. You may have a course that meets a couple times a week. You may have a course that meets once a week. You may have a course that meets 3 times a week. So it's not like a block schedule daily. You do have a daily schedule, and that remains the same weekly, or weekly schedule that remains the same throughout the entire semester. But anatomy doesn't meet Monday through Friday. It will meet, say, Monday, Tuesday, Thursday, something of that sort. And there are various other courses that may only meet once a week for a couple hours at a time. Any other questions? I'm very happy with the questions that we've had. I'm hoping that we were able to answer all of your questions. And if not, you have lots of people to reach out to get your questions answered. But if you have any other questions that you'd like for us to answer right now, please feel free to ask.
Dr. Bolton, sorry I jumped off and jumped back on. I saw a question about outstanding course credit hours when applying. I don't know if that got answered.
Dr. Hale tried to answer that, but we can confirm with you.
Okay, yeah. What our policy is now is to have no more than 3 outstanding prerequisite courses. Outstanding, total cumulative courses, no big deal, because many of you who may be applying might be in your senior year and have a whole spring semester. But 3 prerequisite courses or less is what you can have outstanding at the time of application. It seems a little bit restrictive, but the problem is really when we're evaluating 600-700 applicants and the vast majority of them have all of their grades, those people who don't have 4 or 5 prerequisite grades, we don't really have a full picture of your capabilities through those courses. And so it doesn't really allow you to be compared apples to apples to those applicants. So do what you can to get all of their prerequisites done, at least up to 3 before you apply.
Thank you, Dr. Turner, for confirming.
I don't see any other questions on the chat, although I think I'm willing, and maybe a couple others, to hang online for a couple more minutes if people are still in the private chat boxes and talking, because I think we're really just thrilled that you came out this morning, and really hope that you're excited about our program and are happy to sit here and answer any questions while we finish up this morning. Does anybody else have anything they want to say? No. So like I said, feel free if you're ready to go. We're going to formally close this part of the program. Again, I can't thank you enough for taking some time this morning to visit us. We wish you the best as this semester continues. We realize how challenging and different it is, and what a stretch to your learning. But we wish you the best, and we hope that we hear from you very soon.
Thank you to everybody that was able to join, and thank you to our students for taking the time on your Saturday that you did not need to join and answer questions. We really appreciate it.